Hi, I'm Dr. Rogoreze. Question: why do my gums bleed? Now, first thing to note is if your gums bleed, then it's usually because there's something adverse going on. Healthy teeth and gums, healthy gums don't bleed. So please, if you've noticed that your gums have been bleeding, I would advise you go to see your dentist for further investigations. Now, the most common reason for bleeding gums is inflammation. Now, that inflammation could be as a result of gingivitis or what we call chronic adult periodontitis, now, which is a form, if you like, of bone and gum disease. Yeah, so it's much more advanced than gingivitis. Now, with gingivitis, it tends to develop as a result of bacterial buildup around the teeth and under the gums. So, for instance, the bacterial buildup tends to be in the form of plaque and tartar. Now, these form over a period of time from eating sugars and different types of foods which attract bacteria to the teeth and to the gums, and then gradually the plaque and the tartar are formed and they lie and sit under the gums and cause the gums to bleed and become red and sore. So that's gingivitis. Now, with chronic adult periodontitis, that's slightly different, because with this form, the bacteria manages to creep its way much deeper underneath the gums to the root surfaces of the tooth. And as it creeps its way deeper, it tends to eat away at the surrounding ligaments, it eats away at the bone, and it also eats away at the gum around each tooth. And as it does that, it creates pockets or spaces deep around the teeth. And so these pockets can become more and more filled with bacteria and cause further wear and destruction. Now, all of these things also tends to cause inflammation around the teeth and gums, and the gums can therefore bleed. So those two, gingivitis and chronic adult periodontitis, are the most common forms of bleeding gums. Now, another thing that might cause the gums to bleed is trauma. So it may be that you were brushing your teeth a little bit too hard and maybe you scratched your gum, or maybe you've eaten something sharp which has got caught in your gum and caused it to bleed. So that's another common reason. Now, the third reason could be that you have possibly an underlying medical condition. Okay? Now, there are a number of conditions that may cause bleeding gums. So sometimes it may be worth you consulting your GP to have an overall health check to identify any other possible causes of bleeding gums. So there you have it. So please, it's very, very important. If you do notice that your gums are bleeding, please consult your GP and your dentist for further investigations to get it treated and hopefully get it sorted. If you have any further questions, please do not hesitate to contact us, and feel free to browse our video links. Oh, in fact, another thing I should mention is with bleeding gums, the hygienist is often a very, very key aspect to repairing, to fixing and improving the situation. So there you have it. Take care. Bye.